Thank you to the cities for sharing your experience, as well as Dr. Giano for expertly managing the session. We really appreciate your assistance, Dr. Giano. Colleagues, slightly embarrassed. We're running a little bit behind time. I really do beg your indulgence. I think the content that we're engaging in is actually quite an extensive one, and we have a lot of input. I really do beg your indulgence, possibly for another half an hour, if possible. But I'd like to now go to the next session, which would be moderated by the Secretary General of Metropolis, Octavio de la Vaga. Metropolis has been a partner in developing public space advocacy at a global level. We really appreciate the support and the energy that Metropolis brings towards advancing public space development. Secretary General Octavio, over to you to manage the inputs for the next session, as well as the inputs from your expert panel. Colleagues, I'd just like to remind you, in terms of your input, if you could be quite focused in terms of the points that you want to make forward. Secretary General, over to you.
Thank you, Bhuvan, and good afternoon to everybody from Barcelona. And thank you for this opportunity. And I also think today we are connecting many dots and connecting energies and putting together energy, working together, you, Buenos Aires and Durban, as the presidents of the Committee of Strategic Urban Planning of UCLG, as well as Metropolitan Section of UCLG. As you said, we've been working during the last years, especially on public space, but it's true that our perspective so far was based on issues on gender approaches to public space and safety and security of public space. And now working with you and this opportunity that Buenos Aires and Durban, they are joint members of UCLG and Metropolis, you brought us as well into the discussion from a different perspective of public space. In fact, it looks like everybody has discovered or rediscovered the importance of public space, thanks, and this is sad, but thanks to the pandemic, as a space of developing, for a critical place for people to develop themselves physically, mentally, and at all levels. And I mean, the previous interventions of representatives of the different cities, they highlighted that no public space is where people meet, is where you find the soul of the city, or where things happen. And we have been confronted that probably in the urban development of many cities in the latest years, we had forgotten about that and the public space, and which is critical. Never mind. I think with the inputs that we have heard from the keynote speakers and the previous panelists from cities, and now I would like to give the floor to different experts that I think they will, from different organizations, that I'm sure they will react to what they have listened, but as well they will provide their inputs and their perspectives. And we'll be starting with Laura Petrella. She's the Chief of Planning, Finance and Economy section of UN Habitat. They are producing an integrated health, and how they've been working on how to integrate health in urban planning. And I know they have released a book, and Laura will be introducing and presenting the contents of this book that I'm sure it will be help us to enhance and develop the debates that are having today. So Laura Petrella, is over to you. I'm not sure I can see you. Yeah, you're there. Perfect.
Yes, I'm here. Yes, thank you very much. I'm trying to share my screen. Yes. I hope this will work. Sorry, I'm.
Okay, now we can see it. We can see your presentation, Laura. So
You can see, okay, thank you.
yes, whenever
Yes,
you want.
so, yes. I have too many things open. Yes, do you see also if I do like this? You still see?
Much better, much better.
Okay, thank you very much. Sorry for technical itch. So yes, thank you very much. This is a excellent interaction. I think to bring together this different perspective on health, from the health and the mental health in particular, and the more planning and public space expertise. So I will try to just give some highlights from UN Habitat perspective. I think there has been already quite a lot of coverage of what is the contribution of public space to health and well-being, and in particular of the contribution to the mental health. And I don't need to go too much over this again, from the protective factors to the promotion on health, to the overall provision of services that can happen in public space. And I think the more ecological aspect, the overall quality of public space link with the human well-being. So we also know that the pandemic has been really revealing a lot of these dimensions in a very sort of more strong way, and many of the participant speakers have talked about that. We have seen it both in the emergency itself and also in the more building of the resilience of the community and of the individuals to the impact of the pandemic and of the measures to respond to the pandemic. So what I would like to do more is actually talk about the public space, and how we can work to improve this link and this, let's say, support that public space provides to mental health and health in general. Reminding, first of all, that we come from very big ambitions and a very clear understanding of the role of public space from the Sustainable Development Goals and the new urban agenda, where we have a target on public space. And these are international ambitions that many cities and many, let's say, organizations are very much working towards. And this in a context where we have actually a situation of shrinking and quite not well planned and not fully accessible public space in many cities of the world. We know that the share of public space is not adequate in cities. We know that public space are being badly, let's say, managed. They are being privatized, etc. And I think this reflects in weak planning frameworks. There is issues of inequality across the city, and very strong, very important lack of understanding and knowledge about public space. So we end up with a lot of probably poverty, let's say, reflected in public space and the public realm in terms of the capacity and the pressure on public space from many different dynamics. So what we have also seen, and I wanted to mention this because it's very recent document UN Habitat has just launched about the pandemic. We have seen that this has been actually completely reconfirmed, that the role of public space in the pandemic has been analyzed in this report a little bit more in detail. And we have seen two main recommendations that we would like to make on this, which is actually to work more on the neighborhood level and renew the importance of local living. I think this has been mentioned by many of the participants. We We need well-planned density and mixed use, which encourage lifestyles that are more healthy and community cohesion and equitable access to amenities. And also at the same time, public space need to be more flexible, more open, more able to accommodate different activities, and they need to be distributed more equitably across the city. So the report is available, and I can share also the link. How are we trying to respond to this? And I want to mention one of the main initiative that we have in linking actually urban planning, urban management with health, with the health sector, which is work we are doing with the World Health Organization, which builds on the understanding that the way we build cities and manage them can have a huge impact on the health of population and also of the environment. And the source book that we have developed together with WHO is actually looking at the process and also at the specific concerns that we have to include in urban planning so that the contribution to health outcomes is optimized. And if we actually work on this from a perspective of public space, we can see that we need much more intersectoral work, much more collaboration and looking at public space from a lens of health so that we understand it better, we have new data, etc. We also need to look at health as an outcome of urban planning processes and urban public space processes, so that we can really address health inequality in cities. And we also need to consider public space as an asset for the process in the cities of decision making, of participation, etc. And we have a lot of tools that we have identified about the assessment of the health impacts of public space and the distribution of the effects to different groups of population, etc. So just to conclude, we as the UN Habitat have developed many tools on public space and a whole process of working with public space, which build actually on the experience of cities to a large extent, and also the public space networks that Hetan, for instance, represent, etc. And we have a number of tools and a number of, let's say, steps that we engage cities with, and we have materials. And we are working more and more to introduce very concretely health dimension into all these materials to enable this relation to be developed through the different steps of public space improvement, etc. So we have many projects, many pilot projects as well, which we could discuss, but I think the cities here have presented already quite a wealth of experiences, so there is no need so much of talking about the specific project or maybe the citywide strategies that we are promoting, which are really with the main objective of improving the equitable distribution of public spaces across the city as a very first step to ensure community can access the benefit of public spaces eventually. So I wanted to use this information to share it with the audience and with the cities in particular, because these are efforts we need to do in a very let's say collaborative and very collaborative and let's say integrated way. And I wanted to just doesn't continue. Yes.
I'm
so
afraid,
I just
Laura,
wanted
we
to
have
conclude.
one minute.
Yes.
One
Yes,
minute more.
I'm concluding.
Oh,
sorry, didn't move the slide. So I just want to conclude with a sort of way forward from the perspective of our perspective, which is very much global, but also thinking of how we can support, and we can work together with all of you to actually build on all this discussion of today. And we think that we need to work on understanding the public space better. We need to actually build a well-distributed and connected system in cities. We need to use this health lens to the public space much more in the work that we do, and this the collaboration with WHO is very important in this dimension. Monitoring and evaluating the health impacts, and then building more interaction between public health and urban development and planning professionals. And finally, in more concretely, we are working on the training curricula, which we would like to work on with partners on. We are animating a global network of experts and advocates on these topics. We are actually thinking that building new consensus on greenery standards would be very important to give really some measurement and some stimulus. And then, of course, we need also to work on innovative solutions. And at the beginning, it was mentioned the link with climate change. And I think that's absolutely fundamental to be able to do all these things in a sustainable perspective. No? So I just want to conclude here, and thank you very much for the attention to everybody and to the partners of this event. Thank you very much.
Thank you, Laura. And you have highlighted some of the words that we have been having the discussions previously when we have the live learning experiences that was Secretary General of UCLG, Emilia, was referring before, and now in discussions today on the public space that we need greener, healthier, and safer cities, and this is played at the moment that we design public space. We are moving now because, as I said before, we're running a bit out of time, to Ms. Barbara Holtman. She's the author of the book Safer Community of Opportunity Tool. So, Barbara, if you are there,
yes, I am.
Wonderful.
I am.
I can see you. Go ahead. Thank you.
Thank you. I'm going to be very quick because I know you have a time issue. So I think for me, one of the biggest issues that has come up over COVID has been that that in terms of pain and suffering, we can all manage short bursts of very extreme pain or sadness or grief. But the thing about the pandemic has been that it's been open-ended. And I think that has meant that many people who have previously not spoken about their feelings and have previously not admitted to some of their mental difficulties have finally started to talk about them, and that in a way is a very good thing. So I think in the discussions that have been happening here today, there are a couple of key things that I really would just like to highlight. The one is that in the course of the work that I've been doing with UN Habitat Safer Cities on the Urban Safety Monitor, one of the things that has begun to obsess me is how we measure what we want less of and how we measure what we want more of. And in terms of public space and mental health, it occurs to me that these things are very simple in a way. What we want is less testosterone in public spaces and more laughter. We want to experience less anger and more love, less frustration and more creativity. And so in a way, the issues of how we design and manage public space are really about trying to make everybody useful in that process. I mean, one of the things that we've found that is hugely problematic is that the more green space you have in a city, the harder it becomes to actually maintain that space. And particularly in a society like in an environment like ours, and I suppose, again, very much linked to the issue of climate change, where we have an enormous amount of rain, green space, public space is not necessarily an asset to a city, particularly in a city where there is a lot of informality. So it's easier to create public spaces that are formal than it is to create public spaces in which people can informally engage. places that are aesthetic and places where people can participate in activities that will that will make them feel useful and feel that they have agency. This is obviously particularly true of women. And I think women who have suffered a lot from, for instance, in South Africa, the issue of alcohol consumption during lockdown, and I mean, generally speaking, the issue of alcohol consumption in public spaces and in private spaces is a massive problem in a society where we have the kind of drinking problems that we have. So I love the idea that Ethan said earlier about walking. I think that public space needs to be seen as anywhere where we can do things safely and in an inspired way together, including, for instance, doing things like walking instead of sitting and drinking, including, as the image that Lara just shared really has inspired me, gardening, which also, of course, helps with the issues of food security and climate change. And the issue of being more creative. And so in terms of creating aesthetically pleasing public spaces and useful public spaces that will help people maintain good mental health, I would say that possibly the most important thing to do is to not impose any one kind of aesthetics on anyone else, and allowing people to create those public spaces together in a way that reflects many different aesthetics and many different needs and uses. Thank you.
Thank you. Thank you very much for your message, for your clarity and direct, and this idea of public space as a space. I'm sorry if I'm being redundant, as a space for diversity and creativeness, and for a place where are taking place different realities. I think it's very, very important. And now we're moving to Dr. Natalie Redwell. She is the head of urban health and social determinants of health at the World Health Organization. Dr. Natalie, whenever you want, it's over to you.
Thank you very much, and thanks for inviting me to join the panel. And as Tolu did at the very beginning, please let me start by wishing you all a very happy World Health Day 2021, which this year is focusing on building a fairer and healthier world. And well, unfortunately, our world is still an unequal one, and we have heard that. And it's unequal as to access to health services, but it's also still unequal to access to clean water, environment, food, and many more determinants. And all this is entirely due to the conditions in which people are born or live or grow. And the current pandemic has really been underlying these inequalities. And has been stressed during today's discussion, during the pandemic, different population groups have actually faced differently the restrictions that have been put in place in the access to public spaces. And the impact has been very different on their physical and mental health. But I think what is important for today is that these inequalities are actually preventable. And this is what makes this event today so important, because the way that we build and shape and use the cities and the infrastructure is really a key way to address the health inequalities. And I wanted just to briefly react on some of the points that have been raised in the previous contributions. So firstly, there is no doubt that the effects of public spaces on health have been increasingly attracting attention in political discussions and research. And scientific research, has been shown at the very beginning, is converging towards the existence of really a quantifiable association, particularly if we look at green spaces, both on the physical and mental health. And indeed, when we look at the opportunities that do exist on the urban scale to protect, but also promote health, we see that urban areas offer really great opportunities for a really positive change and the sustainable development of our cities. And this is particularly true if we really look at health inequities, because we know that urban interventions, including interventions targeting public spaces, have shown to have a high impact amongst the people in the neighborhoods of very low socioeconomic status. And maybe building on Karen's comments in the beginning on the translation from science to policy, the fact that there is a recognition of public spaces as a public health intervention on one hand, but at the same time, the fact that there is an increased recognition of the role that the health sector actually can play has also led WHO to scale up and also diversify technical support in addressing urban public spaces for health. And I would like to mention very few ones. The first one is just to stress in the current situation of the pandemic, the importance has been given on building healthy, livable cities as one of the key prescriptions that was made actually in May 2020, so just a few months after the pandemic broke out, in WHO's manifesto for a healthy and green recovery. But at the same time, also the recognitions of the importance of public spaces in the preparedness, in the response to the pandemic, such as public markets, for example, where there is a need to provide concrete recommendations on how to shape them, but also how to use them. But also the need that has been identified to providing support on the mental health impacts of the pandemic. The second entry point is the increased recognition that the role of public spaces has been actually given within WHO strategic advice to member states. So just a few to mention here, not only green spaces, for example, are highlighted in WHO's approach to health, environment, and climate change, where actually you would expect them to be included, but actually public spaces are also clearly identified and reflected in strategic plans on aging or other areas. And I think this is something that was highlighted in the example from Munich with the where the importance was highlighted to use different entry points, also targeting different population groups. The third one entry point is really an increased work on looking at the evidence, but also developing tools that would help local governments to quantify the health impact of public spaces on health. And we have been working, for example, on one specific tool on green spaces and health, which is called Green UR. And the fifth and last example is really the role of public spaces within urban and territorial planning. And Laura highlighted the joint work that we have done with UN Habitat on that. And Sylvia also stressed this priority area of planning and health in planning. So I think that all these activities are really a testimony of the range of scientific, but also policy work that is evolving and diversifying. But I would like to close with a couple of issues that from my perspective are still outstanding and do require some further work. A large proportion of the work around public spaces and health has been done in the global north. And I think that there is a need for supporting further work in other regions, which remains a challenge. Also, the definition of public spaces, this is again has been highlighted in the contribution by Munich, is an important issue that still needs to be resolved, because it doesn't only vary across countries, but also within national and local governments within one and the same country. And lastly, I think that analyzing the health impacts of public spaces cannot be seen separately with issues about accessibility, but also the quality of the spaces and also the scale of the continuity of the spaces within a certain area, because otherwise we will continue to create inequalities. So these are just like a couple of points, food for thoughts. I think that I see them actually, these points, more as a motivation to roll up our sleeves and really continue investing in this very important public health priority. So thank you very much for your attention.
Thank you, Natalie, and for your words. And I think your final remarks are very critical. And I saw before in the chat that someone was saying, well, the approach to public space is an intersectional approach, because issues of, as you said, accessibility, scale, shape, but as well the uses of public space and the health, how we develop healthier public space. So everything is connected. So, and this policy approach that has a holistic approach to public space is, I think, is more critical than ever before. So thank you for your words and your intervention. I think was quite a full dynamic today, and I think still I've seen as well a message from Emilia saying, well, this is a powerful, today we had a powerful session, and this starting point, it's not the final point, it's starting point. Many issues have risen. We have still some they have been told by the organization, we have still some minutes for if there's someone who wants on the chat to share a question for the panelists. Otherwise we'll move to the wrapping of the session. So if anyone has any question that would like to raise right now, you can do it.
Yeah. Okay.
I don't see anyone asking. anything. So maybe we can move then to the wrap up. And I would like to invite Mrs. Cecilia Anderson. She's the Director of Public Space Program at the Urban Planning and Design Branch of the UN Habitat. So, Mrs. Anderson, it's over to you.
Yeah, thank you very much, Octavi, and thank you so much. I think this has been a really, really rich session, and we've heard a lot today about how important public space is for people's mental health and well-being, particularly for women, young persons, older persons, and also persons with disabilities. And we've listened to these wonderful experiences from the cities and from different experts on, public space and how important public space. I love this connotation of public space as the living room of the city and how important it is for us in that sense. The pandemic has really shown us how important public space is for people's health and well-being. And these spaces are, just like Ethan brought up, they're changing and they're being reclaimed. And we can actually talk about maybe public spaces driving the process of reinventing our cities. This place-led development to create more equitable and healthy spaces, places where people can build each other up. I really like that, which was brought forward. And also, we've also been talking about creating these new spaces, for example, the digital space, which has come up. I think the Mentimeter was super. It actually showed us how important public space is for leisure, exercise, relaxation, and switching off and socialization. And this is really that living room experience of the public space. So we've learned a lot of valuable lessons from the pandemic, like the equitable access to public space, and how much public space is actually an asset for building resilience of communities. We also heard about the source book, which is a super resource with various tools that can support cities and local government in how to actually mainstream health into their planning processes. So going forward and building on a lot of this ongoing work of the partners that have been around the table today in this session and that have come together, I think we are all committed to build on this and to take this forward. Just like Emilia was saying, this is just the beginning of a process. So how can we actually then ensure that local leaders and professionals have that knowledge, guidance, and the tools to be able to integrate health and well-being into their urban development decisions, programs, plans, and processes? How can we actually support local governments in transforming our cities, and that public space could be that vehicle to actually transform our cities and create these more healthier urban environments? And also expanding the relationships and that learning between cities. So having this network of cities come together and support each other. I think one of the key elements that was also brought up by Barbara was sort of what are we actually measuring and monitoring? So maybe this is an area that we can also take forward in actually developing those tools and the way to actually be able to assess and monitor these things. I think this was also brought up, the opportunity to maybe develop a series of training modules that aim at detailing how to integrate health into our urban planning processes and to support local authorities with regards to that and how to integrate that into our public space work. And then, of course, developing those, sharing knowledge, developing those networks, building the capacities and strengthening those networks. And I think this is really an opportunity to maybe develop some sort of guidance or a set of principles of how to integrate mental health and well-being into how we plan, create, manage, and enjoy our networks of public space, and actually invest in our living room, as Pascal brought up. So we are all committed, I think, to continue to raise the awareness around these issues, collecting better data and analyzing that data and how that can inform our decision-making processes and planning processes. I think a really important aspect of this as well is how this can feed into the Pact for the Future of Humanity, which UCLG has been mandated to develop by its World Council. which was held in November 2020, and how to actually renew that social contract and bring about those policy transformations that are required to guarantee equitable access to public services, such as safe, inclusive, and accessible public space for the improvement of people's mental health and well-being, reducing communicable and non-communicable diseases, and ensuring that we build back healthier and more inclusive communities. So with that, thank you very much. And I'm leaving this session really inspired from all these excellent speakers. So thank you very much.
Thank you, Cecilia, and congratulations, because you didn't have an easy job today, wrapping up with all the amazing contents and interventions that we had. So thank you very much for wrapping up. And I give it over for the closing remarks and some messages to Sarah Heuflich. She is the Learning Director at UCLG, and she has been coordinating this session. Sarah, it's over to you.
Thank you very much, Octavi. Thank you very much, Jorge Giorno. Thank you very much, Tallulah, and all the speakers. It has been amazing. You all committed to nurture our work, and this session we can consider a milestone. So the leadership of the committee with Puven and Patricia behind has been instrumental to set this up. But I think we have a milestone now working with Metropolis close towards the healthy cities. The understanding of what a healthy city is, as Pietro was mentioning in the chat, between physical and mental health, we need to connect. We need to see the mental health is an important indicator of well-being. And so we have to work also on indicators. So how do we use health indicators in development and also in urban development? If we go back to all the inputs that were showing the same message, that healthy environments are not a given because many of our population live in conditions which are not really well equipped with public spaces. So from our side, Emilia had to leave, but she told me that she is really into it, and we will combine, we take it up in the agenda around violence and peace, because this mental health issue and the public space work is very inspiring also for action. Many of the cities are really doing action and learn from each other. So we as a network, with all the networks with us, and also with the UN agencies with us, WHO and UN Habitat, and maybe others, we are ready for doing more. So this one is a starting point towards maybe the guidance, what was said, or training, but also to look a little bit around practices that can inspire each other. We have an instrument for this. It is named Local for Action Hub. And thank you so much for all the commitment. We will write a small report. We also have a recorded big part of the session. And the whole UCLG team has been committed so that we will have a good result. And we will come back to you, to all of you. And it was very nice to see people from all over the world connecting today. So thank you very much for making our network so great.